everyone, my name is Justina Benici, and today I am your Infection Control Officer. We will be going over OSHA bloodborne pathogen standards and CDC guidelines. This is a look at what we will be covering. So we'll also be covering waste management, guidelines for infection control in dental health settings. We will be identifying violations and/or incidents, presenting corrections and/or resolutions, and we'll be explaining the purpose of annual training. So before we move along, I feel like everyone should know the difference between OSHA and the CDC. So OSHA is a regulatory agency, which means we have to follow their regulations as dental professionals in order to maintain a safe work environment and, for everyone around you and for yourself. The CDC's role is to ensure that healthcare professionals are aware of the spread of diseases, how they are spread, and how to stop spreading them. So just a little bit on OSHA's history. OSHA was actually founded, it was an act that was signed by President Richard Nixon on December 29th, 1970. The act was created in which the agency formally came into officially on April 28th, 1971. Like I mentioned, they are a regulatory agency, which means we must follow OSHA's regulations in the office space, and it is their responsibility to keep the workers safe and protect their health. So OSHA's mission is to save lives, prevent injuries, and to protect the health of America's workers. They ensure to carry out their mission by maintaining and keeping reports and records of any job-related injuries or illnesses that have occurred in the office. They provide training programs in order to increase one's knowledge about occupational safety and health, and they develop job safety and health standards by enforcing them through annual work inspections. So a little bit about the CDC, also known as the Center for Disease Control. It is a non-regulatory agency, so unlike OSHA, you do not have to follow CDC's regulations because they don't have any. They don't have any regulations. They have guidelines that you can follow in order to ensure, that you're not spreading any disease or potentially in contact with any disease. So their primary mission at the time, actually when they opened, was to prevent the spread of malaria that was going around and other mosquito-borne diseases in the U.S. military during that time. And their purpose is to save lives and protect those from any health threats. They're a major component of the U.S. Department of Health. The CDC's mission is to protect America from health, safety, and security threats that may occur. They fight disease and they support communities and citizens to do the same by following their guidelines. And in order to conduct their mission, they provide health information and critical science in order to protect our nation against any serious health threats. So I'm sure many of you have heard of the CDC due to COVID-19 and what's going on right now. They've been a huge part in trying to set guidelines on how to maintain, COVID-19. So it's really, the CDC is really important in the U.S. Department of Health. So moving on to OSHA's bloodborne pathogen standard. It is also known as the BBP standard, and it should be found in every dental office. Your employer, should have it hanging somewhere. It should be visible to the eye. Along with this BBP standard, your office should also have a written exposure plan. This plan will address how your office complies with these standard regulations. So what are bloodborne pathogens, one may ask? Pathogenic microorganisms that are present in human blood that could lead to diseases and the spread of diseases. So examples of primary concerns would have to be hepatitis B, hepatitis C, and HIV. Other bloodborne diseases that could be caused by viruses or bacteria. Most cases are rare in the US, but I just thought I should include it. The Zika virus on the left and the Ebola virus pictured on the right could be spread through contaminated blood or infectious body fluids as well. So moving on to the risk of exposure. The spread of bloodborne pathogens can occur through direct contact, indirect contact, respiratory transmission, vector-borne transmission. So how these spreads could occur for direct contact would be if one had infected blood or body fluid from one person to another. You know, if you had made contact, if you were bleeding and you touched someone else, that is considered direct contact. Indirect contact would be considered if a person touches an object that contains the blood or body fluid of another infected individual. So if I'm infected and I touch that pencil, and then you go and you touch that pencil, that would be indirect contact because I myself, the infected individual, did not touch you. You touched something that I had touched that is now infected. Respiratory transmission spread. An example of this would be if a person inhales respiratory droplets from an infected individual, either through like a cough or a sneeze. And then the spread of vector-borne transmission, an example would be if a person's skin is penetrated by like a bite or an organism that is carrying the disease, such as like a tick or a mosquito, such organisms that can spread diseases as such. So your exposure control plan, also known as your ECP. Every office should have an ECP, an exposure control plan, and it should be, you should have a written plan, and it should be reviewed and updated annually. So it should be an established ECP, which is needed in order to address how your office is in compliance with these OSHA standard regulations. With the written plan is to eliminate occupational exposures, and the plan should be reviewed and updated annually when new or modified tasks or procedures affect occupational exposure, or when new or revised employee positions with occupational exposure. Required elements of ECP include exposure determination, schedule, and method of implementation, procedure for evaluation of exposure incidents, and it should be accessible to employees at all times. So controlling exposures. Employees are to observe universal precautions in order to prevent contact with blood or other potentially infectious materials. So there should be proper cleanup and decontamination. You should be treating all blood and bodily fluids as if they were contaminated, even if they're not, it is important to do so. Under the circumstances in which differentiation between body fluid types is almost difficult or impossible, all body fluids should be considered potentially infectious materials no matter what. This is just to ensure your safety and the safety of others around you. And you should treat all blood and other potentially infectious materials with appropriate precautions, such as using gloves, mask, and gowns if blood or other potentially infectious materials exposure is anticipated, which it usually is. Use of engineering and work practice controls in order to limit this exposure that may occur. And you should be practicing appropriate hand hygiene. The CDC recommends that appropriate hand washing is the single most important procedure for preventing infections. So it's super important that, along with keeping your area clean and decontaminating everything, that you're keeping yourself clean, washing your hands, and decontaminating yourself as well. So the difference between universal precautions and standard precautions. Universal precautions is the practice of avoiding contact with bodily fluids by any means, by the wearing of non-porous articles such as gloves, goggles, and face shields. The CDC describes standard precautions as a set of procedures designed to prevent transmission of HIV, hepatitis B, hepatitis C, and any other bloodborne pathogens when providing dental care. Blood and certain body fluids of all patients are considered potentially infectious, and to ensure the greatest possible protection for employees, for yourself, and for your employers, you need to establish and maintain a safe work environment. So just make sure everything's clean, everything's disinfected, and be sure to do these things in order to ensure the safety of yourself and others around you. So some of your employer's responsibilities include performing hazardous assessments, identifying and providing appropriate PPE to the employees, training employees on use and care in the office, reviewing, updating, and evaluating the PPE program, and maintaining and replacing PPE. The employees' responsibilities include attending training. They must properly be wearing PPE. They should be notifying their employers when repairs or replacements are needed as such. And they should be taking care of, cleaning, and maintaining their office space. So appropriate PPE examples would include protective clothing such as gowns, task-specific gloves, which are obviously important to protect your hands and your skin. Task-specific gloves just means that whatever gloves, like some offices don't necessarily use latex gloves, others do, so whichever gloves are specific to your task during that time. Surgical masks, face shields, and protective eyewear. This is all important and appropriate PPE examples that one must follow in order to ensure the safety of themselves and other individuals around them. So, moving on next to waste management.